I usually do not want to be the reason someone cries, but when I am the reason behind the cry of a newborn, it makes me smile. If you are an intern in the Department of Pediatrics, you will get to receive a baby and provide essential newborn care. As I have recently completed my internship in the Department of Pediatrics, I believe I can provide you some tips to do well in this internship. But there may be little variation between the college you are practicing. As an intern, you'll be posted in the pediatrics ward, OPD, NICU, PICU, and then OT to receive the newborn. The first thing that you need to do in any kind of internship is to get yourself oriented to the internship. Know what to wear, whether you are required to wear a white coat or a scrub or a gown. And then you need to understand what your resident wants, whether you should be present there throughout your duty hours or being on call is enough. Okay, let's start with the duty in the OT. In the OT, you will be receiving a newborn. Before delivery, get to know about the mother, whether she is term or preterm, and what is the indication for CS. Make sure that the equipments necessary for resuscitation are present and are in working condition. Make sure that the radiant warmer is turned on. Learn about the neonatal resuscitation program really well. Know about the APGAR score. Know what is normal for a newborn. Let's say the respiratory rate of 50 is a problem in an adult, but it's completely fine in newborn. Learn how to take anthropometric measurements correctly. Examine the newborn for any gross congenital anomaly. Learn to swaddle the baby. Reveal gender of the baby to the mother. Don't just say so. Know when to give the child to the mother side and when to shift the baby to the NICU. If everything is fine, baby is shifted to mother side and skin to skin contact is established as early as possible. Now, NICU duty. Mainly sick children are admitted in the NICU. Learn different causes of respiratory distress in the newborn. Learn about the different modes of airway management used to maintain oxygen saturation. Learn how to feed a sick child, cutlery spoon feeding and the feeding through OG tube. When swallowing, infants tend to swallow a lot of air, which they may regurgitate and aspirate. So, learn proper burping technique. Neonatal jaundice is a common cause of admission in NICU. Learn about neonatal jaundice, phototherapy, and exchange transfusion. See how the baby is progressing. Is he gaining weight consistently or not? Learn how much fluid is administered to the newborn. Try to learn as much as possible about the fluid therapy in newborn. Too much and too little can be problematic. Learn to identify and treat neonatal hypoglycemia. Calculate how much of D10, that is 10% dextrose, is given to the newborn and over how many hours. Learn about neonatal sepsis, the causes of it, and different antibiotics used in the NICU. Learn to identify neonatal seizure. Differentiate seizure from jitteryness. And the other time you will be posted in the OPD. Most of the time OPD case is about reassuring patients because they are the new parents and they don't know what the baby is going through. So most of the time it's the normal phenomena that we have to reassure to the patient. Many patients come for routine newborn visit and immunization. Learn the immunization schedule and developmental milestone. Know what is normal. Children are not small adults. What is normal for them keeps changing throughout the time. The way I remember them is that the heart rate and respiratory rate for the newborn is very high, and it gets lower and lower as we grow older and older until one day it becomes zero. Carry a chart flashcard to constantly look upon what's normal for the newborn. Learn to take history. Practice taking history as far as possible and do basic examination, at least do inspection, palpation, and auscultation. Promote exclusive breastfeeding. Take weight of all baby. If there is child with failure to thrive, first to be affected will be weight and then height and then the head circumference. Take anthropometric measurements for the children below 5 years of age. Learn different modes of oral medicine, like who needs a drop, who needs syrup, and who can tolerate tablet. In the ward duty, you have to find out the reason for admission in the ward. See what medications they are under. Try to remember the weight of the patient. In the pediatrics, the drug dose has to be adjusted according to the weight. Stay on round with the consultant. Trace the reports of the patient. Inform for consultation from other departments. Complete the paperwork and monitor growth and development. In the PICU, learn about the different cases that are admitted in the PICU. Understand the reason for their admission. Monitor their vitals regularly. Learn different modes of oxygen delivery. And stay in contact with your senior and inform your senior in case of any emergency. So these are the basic things that you are required to go through during your pediatrics internship. And if you are ready for this, then I hope you will have a good time. Thank you.